This is a known case of Rosai-Dorfman disease. CT scan of face, neck, chest, abdomen, and pelvis has been done. Rosai-Dorfman disease is a rare benign idiopathic proliferative disease that involves phagocytic histiocytes. It has got nodal and extranodal manifestations like in orbits, bone, and kidneys, etc. Now, this is a contrast NAN CT scan of face. Please observe, see this erosive destruction of the lower part of left side of frontal bone. It has involved anterior and posterior tables of the frontal sinus. There is an associated mass which extends into the anterior part of the anterior cranial fossa. It appears to be extradural in location. The mass has eroded both cribriform plates, right nasal bone, like here. This is avidly enhancing mass lien. There is destruction of the superior margin of left orbit, anterior part of the left orbital plate of frontal bone. Now please observe that the mass has eroded both cribriform plates. Erosions of left cribriform plate and left lamina papyracea are relatively more obvious and pronounced. Mass extends into left ethmoidal sinus as well as into the right ethmoidal sinus. There is no involvement of extraocular muscles. There is no intraconal extension. This is the sagittal scan. Please observe here bone erosions, extension of this mass into the anterior part of anterior cranial fossa, erosions of the cribriform plates, extension of mass into the ethmoidal sinuses, and anterosuperior part of left orbit. Now I will show you his CT scan of chest. This is CT scan of chest. Please see this erosive destruction of the middle part of left clavicle here. Lungs are clear. Ill-defined erosions involving lateral part of right sixth rib. Ill-defined and well-defined lytic lesions involving bodies of multiple thoracic vertebrae. The involvement of DV6 is relatively more severe, both of its pedicle, neural arch, and spinous process, along with the superior and inferior articular processes, are eroded. Similar, fairly well-defined lytic lesions in rest of the vertebrae. Sclerosis is present along the outer margins of some of the vertebrae. This is body of LV1. Please observe slight surrounding sclerosis. This is CT abdomen. No lymphadenopathy in its upper part, but enlarged lymph nodes are present along left side of aorta, this one here, posterior to the right side of inferior vena cava, this one here, along both common iliac vessels. All these are the enlarged lymph nodes. Both external iliac vessels in lateral parts of both pelvic cavities, these lymphoid masses here, as well as in both the inguinal regions. These are all the components of the Rosai-Dorfman disease with nodal and extranodal components. Please observe this massively enlarged prostate. It weighed approximately 119 grams. This has involved adjacent posterior wall of the urinary bladder as well as lower parts of the seminal vesicles. So the possibility of this being also a component of Rosai-Dorfman disease, or maybe this is an isolated growth of prostate, cannot be excluded. Please observe this hugely enlarged prostate, which is projecting into the base of urinary bladder. It has involved posterior wall of lower part of urinary bladder along with the lower parts of both the seminal vesicles.